the osteogenic tissues and hematopoietic tissues. So this brings the relationship to establish how we are close, establish the relationship with the compact compartment of the bone marrow in a bone. It has got a medullary cavity, as we know. There is a space where the bone cells and the blood vessels are there, regulating the entire movement. The osteoclast blast are the precursors which we are not concerned because we have been not taught on molecular science. These are the precursors of hematopoietic and mesenchymal cell origin. Means I would say rather osteoclast come from the hematopoietic origin, whereas the osteoblast from the mesenchymal origin. These are small molecular sciences which I am going to tell you why they play a major role in this complete system. Before going to that, what is a master cell stem cell? I'll brief you in short. If you see in brief, I'll go a little faster because time is constrained. I have seen people are budging the call. The time is going to get out. This concept of stem cell comes from the first cell which gets from the ovum and the sperm and ovum, which indicates this cell carries your genetic code coming from mother and father and decides your future, what you are going to be, what is your color, what is your language, what are you going to live for, what suffers are going to be there. This indicates this code which is present in this cell is a master cell, and a call master is a stem cell. This is a stem cell which decides the future of your entire growth. And at the time of birth, if you see, you are 2.5 kg, and when you grow to 16 years or adolescency, your weight is 60 kg. Bones are small and they grow up. This indicates the dynamic movement of bone marrow. Stem cells, what we use from the bone marrow are hematopoietic and mesenchymal stem cell. There are other sources. Let's go a little fast because time is running. The entire umbrella of regenerative medicine comes for regeneration, restore, replace and repair functions, of which today we will focus on the orthopedic, where we look into some kind of chemokines, growth factors, exosomes, as well as some stem cells from the bone marrow. Media talks of all these things nowadays. I have been seeing almost every conference I'm invited in a gynec, infertility, psychiatric, neurology, where I plead them the science of new age, which is coming as a cutting edge science going to replace the standard practices, which is working out very fast now. This stem cell therapy comes in the concept of repairing kit in your body. I place as a repairing kit. It works continuously in your body, and this kit is 24/7 repairing for you. And beauty of this kit is that subconsciously is maintaining your profile of joints also, wear and tear. You can realize at 70, some people don't have joint replacement. It means there's a wear and tear constantly going on. Whereas for 50 and 50, some people require a joint replacement. This indicates your lifestyle also working on that. Mammalian bone, which represents the structure, what I have shown behind the central is the vessels, and surrounding are the minerals like calcium and phosphate deposited along with the collagen, and the developing homeopathic system comes in the center of the bone marrow where the spongy bone is there. There is an yellow bone marrow and red bone marrow. Yellow bone marrow, which is replaced over a period of time, replacing the red bone marrow, which is present as a spongy bone at the ends, whereas in the center, which is a yellow bone marrow. The ratio I have given you, the presence of mesenchymal cells and hematopoietic cells, how they work. And the presence of these structures along with the dense bone tissue around represents as one organ. Why? Because anatomically, not only histologically, but functionally, they work in unison. The bone replaced in your body is not the same when you are born, it's different, and it takes 15 years, 20 years. It means the bone marrow is actively displacing the aging cells. Now, the only what remains here, the vertebrae, sternum, hip joint and skull will carry a lifetime hematopoietic action. But rest of the bones are replaced by non-functional tissues. And 4% makes the weight of the total body, 4% of the body weight. Now here, when we talk bone and bone relation, remember, The bone is made up of compact bone outside, spongy, and the marrow inside. This makes that this particular tissue range is constantly repairing. When you get an injury, we have seen, we put a plaster and send the patient at home. We don't go for their welding job. I'll show certain slides to you. In most of the articles, I have clearly mentioned there is a repairing system which makes new vasculogenesis. I'm not talking angiogenesis, I'm talking vasculogenesis. Brings in required cells repairing, brings in mineral deposits, a callus is formed, and body takes care. We don't go and chip out the extra callus. Body repairs by resorption. So these are the few examples where I can quote for you to say marrow as one organ playing a major role in all ergonomic, particularly bone, cartilage, then you can say ligaments, muscle, which they work in unison for your movements. This particular association represents the remolding of the callus bone as well as osteoclast and osteoblast junction in close proximity of hematopoietic tissue. Means if you see one of the component of two, osteogenic and hematopoietic, doesn't function properly, you have a disease. And this particular philosophy I have presented with the cross regulation. Means both the systems are working in unison for a physiology to maintain the entire progeny of these cells, which I am going to talk to you today. The hematopoietic niche, particularly when we talk a niche, the niche effect in the bone marrow shows that hematopoietic cells are interacting in that niche cell with osteogenic. If one of the cell doesn't have a physiological function to play, remember the other also goes into disease pattern. This itself shows how the functional relationship between both of them compactly functioning together. Now this is one of the slides which I want to show you. In the electrography, radiography, where you can see the cortical bone showing the presence of in the canaliculi which take care of MSCs. These are mesenchymal cells along with the supporting to hematopoietic action. And the other side which I am showing the canaliculi where the circulation is re-establishing around the osteoclast cells. Now this is a human chip section of bone where CD166 positive cells show the presence of their role in osteogenesis, making the replacement of the bone, old cells and replacing the new cells. Now these shows us the hypothesis, where the hypothesis I say there has to be a homeostasis in the bone compartment where both the systems are working together. If one system is not working together, then I call, whether it is a qualitative or quantitative, I call there is a disharmony and the disease come to picture of pain formation or deformities or any kind of arthritis, any kind of vascular compromises or inflammatory lesions. And whether I had say the living drug molecule bone cell are going to repair it. I'm just finishing some. This is a bone fracture. You can see the way vasculogenesis is taking place, cartilage formation and cartilage replaced by the new bone. This is normally happening. From this story of happening, I would say rather the mesogenic process in the bone shows how we are differentiating different type of cells. I have shown the bone marrow area and mesenchymal area, which shows all the tissues related which I spoke in the beginning are being generated or being developed in the bone marrow. All cartilage, muscle, marrow, tendon tissue, reposing cartilage. This itself speaks. This has a power to repair. Everything what you want to repair as a muscle, as a tendon, as a cartilage, as a menisci, as in bone, they are all present there in the bone. And then we look into the impairment which I showed you, alteration of the both systems not working together. What we do at Stemrx, we collect the bone marrow. This is a standard which I will not talk on it, probably most of them. This is a culture. But I'll tell you point of care, which means in a point of care, the entire concept which I showed you as a bone marrow from the osteogenic, myogenic, cartilogenic, anything meniscal repair can be used at a point of care when in the stem cell therapies. The application at our Stemrx in the bone tissues are from avascular. These are the list where we do work on it. Sir, I'm taking care of 2 minutes more and I'm closing it live. Avascular necrosis is my patented subject where we claim that without bone decompression, bone marrow neck decompression, we use this technology of regeneration of the head using the components of various factors from the bone. We isolate all different factors in the lab and use them with the target delivery in the bone. These are certain picture x-rays before and after. I don't want to take more time. I'll just go to few of my important topics.
Sorry, automatically.
Closing, sir, closing. 1 minute, sir. 1 minute.
Slides are gone.
I'm here to show just about this is my national patent where I claim the benefit of using this technology to repair almost any type of joint, even shoulder, where we think of joint replacement. These technologies can bring in under the patent that we repair the joints using stem cell technologies. Let me express my thanks to all of you. You have given a patient hearing to me. In fact, with the new science coming in, the cutting edge science tells that we need to rewrite our theories, rewrite our textbooks to understand the bone marrow and bone concept to repair the orthopedic diseases. Thank you.